This conference will now be recorded.
And as you just heard, we're going to be recording this session. The special interest group aims to advance rehabilitation and research in the spinal cord injury community. And if you're interested in learning more and contributing to the spinal cord injury community, please email our chair, Dr. Jaren Yara-Fisher. You can also check out our websites to see some of the projects that we're working on and other task forces that we have ongoing. Before we get started, I just want to advise everyone that the meeting is being recorded. And so it will be available on the SCI webinar site in a few days. I'm going to ask everyone to stay on mute and keep your cameras off throughout the presentation. We have at least 20 minutes at the end of the webinar for questions and discussion. If you have any questions, I'm going to get you to type them into the chat feature and we'll bring them up at the end of the session and get you guys to liaise with Dr. Anderson at that time. I also just want to take a moment to let you guys know that we have our ACRM spring meeting March 18th to the 21st, and you can check out our website to get more information on that. And the annual conference is at the end of September, and you still have time to submit your symposia by February 22nd and posters and papers by March 11th, if anyone's interested. It will be virtual and there will be an in-person option for these. And now that we've kind of gotten over a bit of the business aspect, it's my pleasure to introduce our guest speaker, Dr. Anderson Erisman. Dr. Anderson Erisman is a professor in the Department of Physical Medicine and Rehabilitation at the Metrohealth Medical Center and Case Western Reserve University School of Medicine. And she's the Associate Director of the Institute of Functional Restoration. She's lived with a cervical spinal cord injury for 32 years. Her research focuses on translational investigations and bridging the gap between basic science, clinical science, and the public community living with spinal cord injury. At Metrohealth, she's continuing her involvement in clinical trials with the team pursuing implanted stimulation devices for spinal cord injury and further developing her independent research efforts addressing issues important to people living with SCI, with an emphasis on translational research to deploy treatments to the clinic. She's currently the director of the Northeast Ohio Regional Spinal Cord Injury Model Systems of Care. She is also a co-founder and an inaugural president of the North American Spinal Cord Injury Consortium. I'm really excited to hear Dr. Anderson's talk, and so we'll turn the presentation over to her now.
Thank you so much for inviting me to give this presentation. And thank you for that introduction. And I think, can you give me control? Okay, I have control. So today I am actually going to be talking about something wearing my hat as the president of the North American Spinal Cord Injury Consortium. And so, overview. I'll introduce the consortium to you and why we did this effort about COVID-19. And then I'll go into summarizing known evidence about COVID in people living with spinal cord injury, what some of the known evidence is about concerns and impact of the pandemic and the different lockdowns that have been happening. And then, of course, the use of lay language and using and partnering with community networks to promote knowledge translation here, specifically related to COVID-19. But this is a great example of how we can promote knowledge translation on additional topics related to spinal cord injury. So I want to give you just a brief overview of what the consortium is so you can understand why we did what we did. In 2018, the consortium was really developed from grassroots advocacy efforts across the community living with spinal cord injury. The community wanted to be more active and more unified in our efforts. Initially, that was all related to research, but we're trying to expand that because research does impact clinical care and policy, and policy impacts research and clinical care impacts research and policy. So they're all interwoven. Currently, the consortium is composed of other organizations, of individuals, and of partner organizations. So we have 47 members that are community-led organizations. So they're nonprofit organizations led by people with spinal cord injuries or family members, caregivers of individuals with spinal cord injury. And each one of these organizations has a network of members or followers in the community. And these are large and small community-led organizations. And in addition to 200 plus individuals with spinal cord injury and 42 partner organizations. So these could be hospitals, research centers, individual researchers, et cetera, that are all interested in spinal cord injury. So the goal is to try to be somewhat of an umbrella where we can facilitate different things. So the goal and the mission of the consortium is to bring about unified achievements in research, care, cure, and policy by supporting collaborative efforts across the community. And we do that by trying to identify gaps, and that's what we're going to talk about today, but also to communicate resources that are already existing and share them between organizations, and to try to be a conduit for collaboration between the community and the many stakeholders dealing with spinal cord injury. So how did we identify a gap related to COVID-19 that prompted us to write this white paper? Well, since the onset of the pandemic, obviously, the unknown has had a significant impact in the community living with spinal cord injury, in addition to just the world in general. And early on, in the first few months of 2020, basically, there was a lot of information that was spread throughout the community living with spinal cord injury about the suspected morbidity and mortality of COVID-19 in people with spinal cord injury. And say suspected because this was an entirely new disease to try to understand just in general, and then to try to understand it in relation to spinal cord injury. We had to go based on what we knew and what we thought would be impacted or would be risk factors for COVID. So this created a significant amount of fear in the community, and the thought that if you were a person with spinal cord injury and you got COVID, that it was going to basically be a death sentence. And slowly there were peer-reviewed publications that started to come out describing case reports about the actual course of COVID-19 in people living with spinal cord injury. But the consortium noticed that no one was really sharing this peer-reviewed evidence with the community living with spinal cord injury. And so the consortium took the initiative to gather and present in lay language the current evidence base about COVID at the time. So this is the title of the white paper, Evidence Related to COVID in People Living with Spinal Cord Injury. And it covers what we're talking about today, what was known about concerns about the pandemic, case studies of individuals who actually contracted COVID, and impacts of the nationwide lockdown in people with spinal cord injuries. You can access the full link here, and that's also on our website. And it was initially released in November, and we are reviewing the literature every 4 months to make an update to that white paper every 4 months. So it's really what you might consider a living document, and the take-home points that I'll share with you, they may change as more evidence comes out. So we'll start with 2 studies related to concerns about the pandemic. And these were really founded in the initial days of the pandemic. So Dr. Mike Stillman and his colleagues at Thomas Jefferson did a rapid survey of the SCI community, the medical community, and their engagement with their patients in response to COVID-19 pandemic as it was starting. And you can see from the results here that that survey was really done during that first week of the lockdown in the United States, at least, so late March. And in that publication, they shared what the medical community had been hearing from their patients with spinal cord injury. And at that time, there was a big concern about being vulnerable to becoming infected. The fragility of the caregiver system, which we already know is quite fragile. Inability to get routine medical supplies, particularly gloves, and the inability to get tested if someone thought that they might be positive for COVID-19. Remember, in March of last year, testing was not yet widespread. There was also concerns about inability to get transportation to healthcare appointments. And also remember that that was before telemedicine was implemented widespread. And then obviously a concern about the inability to appropriately self-quarantine, particularly if, as your spinal cord injury, you require an individual to help you, either in caregiving or around the house or whatever. So these were some of the initial concerns about the pandemic. There's also a more in-depth survey that was started by Dr. Mondin and her colleagues at the University of Minnesota. And this was really to try to understand the initial impact of COVID on the community living with spinal cord injury. So this was a survey of individuals with spinal cord injury. She's in the process of publishing the preliminary results, and she shared those with us for the white paper. And that was from data collected in June to September. So there's three main areas that she identified from the survey, and one is related to medical rationing and discrimination. So about a third of those individuals reported being concerned about medical discrimination or potentially being denied access to a ventilator if hospitalized with COVID. Remember that this is in a time frame where information about the seriousness of COVID was really based on the suspected risk, and the suspected risk was high. And also based on information in the media about the healthcare system being overwhelmed with individuals with COVID and potentially having to make those difficult decisions where this concept of medical discrimination is out there in the community. Another area that was reported on in this survey was the impact on care in the home and medical supplies. So here, about 60% of the individuals said that the pandemic had had a negative impact on the care that they receive at home, as well as a negative impact on their access to medical supplies. And then lastly, they reported on the impact to overall health and to mental health. So in that time period, about 2/3 of the participants reported that the pandemic had had a negative impact on their overall health and a negative impact on their mental health. And at that time, people were concerned about social isolation and the potential for future prolonged social isolation. So then we get into the case studies of COVID in individuals with spinal cord injury. And there are about 6 of them that I'll review with you. So remember, in theory, there are several legitimate reasons to expect that an individual with spinal cord injury would experience severe level symptoms if they contracted COVID. And that's based on 3 points. 1, weakness or paralysis of the abdominal and trunk muscles causes individuals with spinal cord injury to have weaker lungs. And this is not restricted to cervical injuries alone. Individuals with thoracic injuries down to at least mid-thoracic, potentially a little bit lower, will have weaker or compromised abdominal and trunk muscles. And so we know that with weaker lungs and abdominal muscles contribute to unproductive cough. And having an unproductive cough contributes to risk of chronic respiratory infections. We know there's plenty of evidence out there that people with spinal cord injuries have a higher risk of developing cardiometabolic disease. And there's emerging evidence that people with spinal cord injury have a weaker immune system related to different factors. So all of those, risk of unproductive cough, risk of cardiometabolic disease, and risk of having a weaker immune system are three strongly suspected risk factors in the general population. In addition to age, and age seems to be pretty critical in the general population for having greater problems with COVID if you get infected with COVID. So in theory, people with spinal cord injury are at risk for having a severe level disease. But that's not really what was transpiring in the evidence that started to come out. So the first case report came out of Italy in March of 2020. And this was an individual that was 56 years old, male, had a C4 AISA injury for 7 years. And that individual initially developed a fever, and it was thought to be due to UTI. And antibiotics were given initially at home, and then the individual was admitted into the hospital, and that had no impact on the fever. And then a chest x-ray was done, and pneumonia was expected. And then that prompted testing for the virus. And that individual then tested positive, and antiviral medications were started. And then a couple of days later, the fever started to subside, and the individual went on to recover. Now, one common theme in all of these case reports is that they have not yet followed up long-term, or at least they're not reporting long-term follow-up. So we don't really have a good picture yet of what went on to recover actually involved. Was it slower? Was it longer? We don't know that much information about that yet. But the take home from this case report was that in that individual, cough never developed. And that was initially a strong symptom that we were being asked to look for. COVID-19 testing should actually be done when fever is present, regardless of what the other symptoms are, because this was masked by the thought that it was a UTI. And in that individual, the symptoms of COVID-19 were not severe. So, and you'll be able to see the citation for all of these case studies at the bottom here. The next case study came out of Spain, and that involved 7 cases of individuals with spinal cord injury, 5 of which were cervical, 1 upper thoracic, 1 lower thoracic. 5 males, 4 were AISA, 3 were less than 3 months, 4 were at longer time periods post-injury, and the average age of those individuals was 68 years old. So in that group, fever was the most frequent symptom, followed by weakness, and then other symptoms like shortness of breath, cough, and coughing up sputum were less frequent. The COVID infection in those individuals was considered severe in 5 out of the 7, and that's with the infection rating system. But only 3 of those individuals required oxygen. None of those individuals needed to be put on a ventilator or admitted to intensive care unit for treatment. So take-home message there was, despite having severe infections, the symptoms experienced were not as severe as expected. They reported that all 7 individuals recovered, but this group did report that recovery was slower in those individuals that were older. And you can see that even though the average age was 68, the range was from 34 to 75 years of age. The next case was a report out of the US talking about challenges with screening for COVID in individuals in SCI. And in that report, there was one individual that tested positive for COVID. And that individual was a 78-year-old male that had a T4 incomplete injury. And again, this individual initially presented with fever that was thought to be due to UTI and was treated with antibiotics, and the antibiotics were not effective. A few days after starting treatment with antibiotics, the individual developed a cough. And after neither of those symptoms went away, a chest X-ray was performed and showed changes in the lungs. And that then prompted testing for COVID-19. And in this publication, they didn't go on to report information about the results of COVID because it was related to challenges about screening. So their take-home message was that individuals with spinal cord injury may not present with the typical symptoms of COVID, and they can be confused easily with common secondary conditions like a UTI. So in that time period, they suggested that the criteria for testing should be expanded. Remember, this was back in April, to ensure that the population with spinal cord injury could be appropriately included and caught if COVID was positive. And then there was a larger case series out of Italy looking at clinical features and the evolution of COVID in individuals with spinal cord injury, and they were comparing that to individuals with without spinal cord injury that were COVID positive and treated at that same facility out of Italy. This involved 15 cases of individuals with spinal cord injury. You can see there's a wide representation of injury levels, gender, age, and time post-injury ranged from 2 months to 10 years post-injury. So actually 5 out of 15 of those individuals had no symptoms, so were asymptomatic. Of the 10 that experienced symptoms, none of those individuals with spinal cord had any different symptoms or any different disease severity as compared to non-spinal cord injured individuals treated at the same time in the same hospital. Even though many of those individuals, they reported having underlying metabolic disease, but there's actually not quite that much detail in the publication about what or how severe the cardiometabolic disease was in those individuals with spinal cord injury. Take-home message was that none of the COVID infections in those individuals was considered severe. No one required treatment in an ICU, and everyone that had symptoms ended up recovering. And then lastly, or no, second to last, there's a case, a retrospective chart review that came out of the US veteran population in July. This was led by Dr. Burns. And this involved the new SCI registry that the VA had developed for spinal cord injury and a review of that registry. What they did was look at a little over 17,000 records in that system of veterans with traumatic and non-traumatic spinal cord injury. And in that registry, there was 140 records that had indication that they had tested positive for COVID-19. And of those 140 individuals with spinal cord injury that tested positive, 26 had passed away. And the average age of those individuals was 67 years old. Now there's some caveats that you have to take away with this. And it's a retrospective chart review instead of prospective monitoring of the symptoms. The individuals who may not have been accounted for were those who may have been affected with COVID, but either were tested out in the community and not tested in the VA system, therefore not registered as having COVID in the VA system. or those individuals that were infected but maybe had mild symptoms and never got tested. So there's a lot of caveats that may be missing in this chart review. Additionally, we do know that the US veteran population living with spinal cord injury tends to be older and have more underlying complications compared to other SCI populations around the world. And so that needs to be taken into consideration as well. Take home point, though, despite those limitations, reviewing a large medical record set can actually be quite helpful in providing preliminary information about spinal cord injury and COVID-19. And in particular, here in the US, the veterans with spinal cord injury may be more vulnerable to having a more severe disease course because of their older age and other underlying complications. But we really need to understand age and these other underlying complications in the SCI population before we can really say anything more about them related to COVID-19. So it's still really important to minimize the risk of getting COVID in the population. And then lastly, there was a large outbreak of COVID-19 in Nepal in a inpatient spinal cord injury rehabilitation hospital. And that was initially communicated by us, by Dr. DeCall to us to include in this white paper, and it was subsequently published in December, so you can see this information. In that inpatient rehabilitation hospital, there was an outbreak of 103 of 238 individuals that were either patients, caregivers, or staff that tested positive. And 43 of those individuals were with spinal cord injury. And all of the individuals had mild symptoms, most commonly mild fever and weakness. There was one individual with a high cervical injury that had a UTI that required higher level of care. And of the 103 positive cases, only one individual required referral out to an actual designated COVID-19 treatment facility. So take-home message from that outbreak was that people with spinal cord injuries did not have a severe COVID-19 disease course. No one ended up having any lasting medical problems due to COVID-19 at that point that they published and reported on, and everyone went on to recover. So from all of those case studies, the consortium created some take-home messages for the community living with spinal cord injury. And those take-home messages are based on the data at that time. So one, people with spinal cord injuries are not at a higher risk of actually getting infected with the virus. That's important. Two, the early symptoms that people with spinal cord injury seem to be experiencing seem to be often confused with UTI. So that's an important warning factor if someone does get UTI, to think about that, the potential that it could be COVID. Third, cough particularly, but fever as well, may not be as severe as compared to the general public in individuals with spinal cord injury. Four, everything that we know so far shows that the severity of the symptoms and the disease course is not as severe as we initially expected. Four, like I mentioned earlier, age and underlying secondary conditions, they may still be very significant risk factors, but we need to really understand them better. More information is needed to think about trying to be predictive or prognostic about those factors. And so 6, it's just still very important to still minimize the risk of exposure, obviously by washing hands, wearing a mask, and social distancing. So just to kind of wrap up the case evidence just recently, which was after this white paper was published and in the preparation of this webinar, a rapid review was published, and that involved a rapid review of 28 cases. You can see it was published here ahead of print in Journal of Neurotrauma. Of that rapid review, the most prevalent reported comorbidities was obesity, dyslipidemia, and metabolic syndrome. The most prevalent clinical manifestations of COVID were fever and then cough. 22% of the cases that they reviewed were asymptomatic. 75% based on this early warning system, which is a marker of the infection, pointed to 75% pointed to less severe disease. Majority of individuals did have abnormalities on chest X-ray, and they reported on treatment with antiviral medications. So you would be able to read information about treatment in that publication. And then fewer individuals need to be treated with oxygen, low flow versus high flow, and then actually only one individual needed to be treated in the ICU with invasive ventilation. And then they reported actually only 3 individuals out of those 28 cases reported. So you can look at what NASCIC did as a review for the lay public. You can also look at this scientifically peer-reviewed publication of those case reports. So lastly, there are 2 bits of evidence related to the impact of the lockdown on individuals with spinal cord injury. And the first one of those was actually they were both posters that were reported in the October ACRM conference. One of them was by Dr. Liz Felix and her colleagues at the University of Miami. And they did a survey of individuals in South Florida during the peak of COVID cases that Florida had in August and September of 2020. And they did telephone interviews of 51 individuals with spinal cord injury who were also part of the SCI model system, in which there is follow-up of individuals with spinal cord injury. So because they are part of a model system, they actually have some data on these 51 individuals prior to the lockdowns. And you'll see that here in a second. So of those 51 individuals that they interviewed during that time period, compared to the general non-spinal cord injured population at the time, the individuals with spinal cord injury had similar levels of depression, but actually lower levels of anxiety, which I found to be quite interesting, and wonder if living with a spinal cord injury in general, having to deal with the unknown, whether or not that helped individuals with spinal cord injury deal with the lockdown and unknowns related to that. But also in those individuals with spinal cord injury during COVID isolation, as compared to prior data that they have prior to COVID isolation, those individuals with spinal cord injury did experience more symptoms of depression, less resilience, and greater difficulty accessing healthcare information as well as services, food and groceries, and PPE compared to pre-isolation periods. And you can see the citation for that poster here. So I expect that she'll be publishing that information soon. And then the other poster was from Dr. Schladen and colleagues, related, and this was related to how the COVID impacted the removing the ability to actually access physical therapy and exercise in the community. So they did a survey of 40 individuals, not just with spinal cord injury, but with other neurologic diseases you see here. who had been regularly exercising at 2 community fitness centers prior to the lockdown. And they did a survey of those individuals 1 month into the lockdown. And some of the things that those individuals reported was reduced social connectedness, increased feelings of depression and anxiety, and other attitude and emotional issues, in addition to a decline in physical health, self-reported physical health. Now, they did say that all of those individuals were still trying to attempt physical activity at home. And despite that, there were some decreases in range of motion, increases in muscular and neuropathic pain, worsening of spasticity, worsening of balance, worsening of sleep, and increase in fall. So overall, they tried to emphasize that whole body role of regular and personally adapted physical activity out in the community is really important, because when you actually remove access to that, you see the impact of it. So getting to the conclusion here, what we're really seeing is that the lockdown and the pandemic and all of these issues really are amplifying problems that were already existing. And one indicator of that is something that the consortium did and published at the end of 2019, which was needs assessment survey of our community. And one of the questions in that needs assessment survey was asking people, what's the biggest challenge that you face on a daily basis right now? And you can see pain, bowel, bladder, independence, mobility, accessibility, attendant care, insurance, financial issues, fitness, spasticity. All of these issues were already existing. And based on the data that we've seen, you can see an amplification of some of these existing issues. So there are things that we need to address related to COVID, but there are bigger things that we still need to address related to challenges that our community is dealing with on a daily basis. So what we did, we tried to share across our network this COVID white paper. And you can see here the distribution of members of our consortium and where they are in Canada, the US, and Central America and the Caribbean, because those are all geographic, North America. We sent the white paper to all of our community organization members, which individual, they have a reach to several thousand individuals with spinal cord injury. We also sent the white paper to over 180 professionals in the field of spinal cord injury, including funders at the Department of Defense, National Institute of Health, and the Craig Nielsen Foundation. What we don't know is how all of those individuals went on to spread it throughout their community. We do know from our own social media efforts, things that NASCIC has done directly, that our Facebook posts have reached over 4,200 individuals, and our Twitter posts have reached over 2,200 individuals. So this is one example of how we work together to try to translate knowledge that was coming out in the research community to get that into the hands of individuals living with spinal cord injury. We want to continue partnering on these types of activities with individuals in the medical and the research community to really try to share this information and get it out into the hands of those living with spinal cord injury. So I will end here and leave contact information up, and I'm open for any questions or anything that may have come up. And Swati or Gia, do you want to facilitate those questions?
Yes. I want to thank Dr. Anderson Erisman for sharing this important information with us, and thanks the audience for attending our webinar. And again, I want to remind you that the recordings will be available for the next day or two, and please recommend this webinar to your colleagues and also refer them to the upcoming series. And I would like now to welcome questions from our audiences. You feel free to type in your questions in the chat box. And I do see one from Ralph Nixkin. Sorry if I pronounce your name wrong. But Ralph asked, could you say anything about the mask wearing compliance for people with spinal cord injury? Does mask wearing cause any additional respiratory or other burden on this population?
Right, that's a good question, and I've not seen any data come out about that yet, so I would only be able to speak to that anecdotally. I've not heard of any complications, like respiratory complications, related to wearing masks. I do know that there was an effort to create masks that would be improve compliance for individuals that have to use a sip and puff wheelchair. It's got a little hole in it so that the controls can be operated and the individual can still wear a mask. But I've not heard of any issues related to not wearing, not being able to wear a mask. But I would say, you know, probably the same issues and beliefs about whether or not individuals want to wear a mask, those issues that are out in the general population, they're probably mirrored in the population living with spinal cord injury. There's a variety of people and attitudes and opinions.
All right, we have another question. Do we know if the psychological findings in SCI population are different than non-SCI population?
There is in the survey that Dr. Mondon is in the process of publishing. I have heard her present on comparisons of the psychological health of the general population at a time. So we do know how the general population is faring psychologically during the pandemic, and I believe that she'll be comparing that to the general population or to the spinal cord injured population. In the poster that Liz Felix presented at ACRM in October, she did show that the SCI population had similar issues with or levels of depression, but fewer issues or reporting of anxiety compared to the general population at the time.
All right, thank you. This next question from Bloom Anna. Actually, this one echoes with my my own question. Is there any information yet on the vaccine acceptance rate or vaccine access? And also, I want to add on this question. Is there any research on the effectiveness of the vaccine in this population? Because we know the vaccine is usually trials are done in generally healthy people.
Right, this is a big topic of discussion in the community right now, and I've not even been able to find any information about vaccines in general related in people with spinal cord injuries, like any research about that in general. So I've not seen any information related to COVID-19 vaccines in people with spinal cord injuries. Getting access to them is proving very difficult related to all the issues related to getting access to the vaccine, but it seems like the spinal cord injury population for many states, from what I've seen and from what I've heard in Canada, they're not in that first round of distribution. It's more like the second phase of distribution. So I know in my state, age is the factor that's determining access to the vaccine right now. And any kind of underlying conditions have not been including spinal cord injury yet, from what I've seen.
All right, thanks. Next one is from our own Swati. Do we know if anyone has done an economic analysis to look at changes in healthcare cost?
During the pandemic?
Swati, do you, yes.
Yeah, during the pandemic. I've not seen any data come out yet about that. I hope that people are running those analyses, because I think there is a strong desire by the community to keep access to telerehabilitation or telehealth visits. I know there are some challenges related to billing for that, for healthcare providers. I hope that that can be resolved and that telehealth can be maintained as a very widespread option for individuals with spinal cord injury, because transportation is always going to be a problem. You know, pain is a big issue, and if you wake up that day and you're in pain where you don't want to go out to an appointment, that limits ability. So I really hope that that data are being analyzed.
I don't see any more questions, but I do want to also follow up on that question. Do you think COVID, the pandemic, kind of exacerbated the disparity in access to telemedicine, and how like the disparity to access to telemedicine can further contribute to health disparities?
Probably, again, I'm basing that's not based on any evidence that I've found, but probably because on one hand, it was good that telehealth options became more widespread, but there still is a large proportion of our community that doesn't have access to the internet or to reliable internet. And so that makes it harder for them to get the telehealth access. So I'm sure, because we've seen exacerbation of other problems, you know, like reliable attendant care, et cetera, I'm sure there was an exacerbation of those health disparities that are already existing. I would not be surprised at all if that was happening.
Thanks. Next, we have Rolf Nickton. With gym closed down, what about access to exercise and recreation for people with spinal cord injury?
Right, I've seen a lot of community groups, like either, you know, there's lots and lots of SCI groups on Facebook, et cetera, and different support groups. They've been doing Zoom exercise classes, Zoom peer support, Zoom yoga, all kinds of things that they've been trying to be real creative about. And actually, I just learned last week at the Cleveland VA here, the recreational therapist created a program where they were reaching out to their patients that they are trying to care for and promote improved health, that they were having Zoom exercise activities that were being facilitated by the recreational therapist there. So there's a lot of creativity that has come out of the community and working together to try to improve access and keep active and healthy.
And Toyin Ajisek, sorry, apologies again, is tagging on the telemedicine question. Any sense of whether those whose providers offered guided, structured remote therapy fared better than those self-programmed during the lockdown?
Did structured guided therapy, was that more effective than self-guided therapy? I don't know. Well, one thing I would say is any providers or researchers out there that had experience with this during COVID, I strongly encourage them to publish it, because that's the only way we're really going to be able to start to learn about all the different activities and things that people have done and what worked and what didn't work. So I don't know whether or not the structured activities were more effective than self-guided, but it probably has some bit of dependence on the individual and whether that individual is motivated by self-guided or needs guidance.
All right, thanks. We have another question from Swati. As a researcher that advocates for translational research and has a lot of experience translating knowledge for the layperson, do you have advice for us on how to better inform clinicians and persons with lived experience on our findings? It sometimes becomes a challenge to share knowledge from our research in ways outside of traditional dissemination formats like peer review paper publication.
Yeah, I would strongly encourage you to try to develop a partnership with some of these community organizations. So either with, partner with someone in your local area. Like there's lots of United Spinal chapters, PVA chapters, different support groups and organizations, sports groups, and all of that, to try to develop a partnership with that community organization, because then you start to, by developing that relationship, you can have a different outlet for your research. So you could have a conversation explaining your research to those that organization, and coming and during that conversation, you learn more about the terminology that you need to use and what to explain and what are the key points to include. And then they have outlets out into the community. So you can start sharing your research out that way into the community. And the more that you develop that relationship, the easier that it gets. And social media is not the only way to share information out to the community. You can also, ask a support group, hey, can I come talk at one of your monthly meetings about my research, and just have it in very conversational ways like that. And the same thing goes for healthcare providers, ask if you can present at grand rounds or something. And they're very busy individuals, and they may really appreciate your volunteering to share your research information. But think about it, when you're sharing your research information, think about the end user of it. So the way that you share your information for peer-reviewed publication is very, very different than the way that a clinician would want to use that information, or the way that an individual with spinal cord injury or a community group with spinal cord injury would want to share that information. So basically, kind of start to learn your audience.
Great, that's very good advice for us. I think we're almost at the end of our meeting. So if anyone have any questions, would they be able to email you, Dr. Anderson?
Yes. Yeah. Yes.
Great. Again, thank you everyone for your attendance, and thank you, Dr. Anderson Erisman, for this amazing opportunity to learn about COVID in SCI. And we will share, let everyone know about our the recordings. I think I see there's some questions about availability. It will be available in a couple of days, and we'll share that with everyone and share this amazing talk. All right. And here, just a shameless plug. These are our spinal cord injury ASIC task force groups. And you can find all this information on the ACRM website. And I think that's it. Thank you everyone again for coming.
Thank you.
Bye.
This conference will now be recorded.